Thank you. Thank you very much. So, why are governments so concerned about the cost of healthcare going into the future? Let's start with you in this room. How many of you have experienced symptoms in the last week? And how many of you have been to see the doctor? A lot fewer have been to see the doctor than have symptoms. The problem is that it's not the people who actually go to doctors who have the most to gain from medical intervention. In fact, it's the patients who have chronic and complex illnesses, diabetes, heart disease, and cancer. Many of these people have symptoms and never darken the door of the doctor. Some of them don't have symptoms at all. And yet, if they were diagnosed today, would have so much to gain by an early treatment in terms of their prognosis. The numbers of these people is set to expand beyond all measure. Let me introduce you to Dave and Sue. Dave works for the bank. Sue is a dental nurse. They're in their mid-40s. They have 3 teenage boys. By 2030, Dave and Sue will be in their mid-60s. They will have lived long enough to develop chronic and complex illnesses, diabetes, heart disease, and even cancer. So will 1 in 4 Australians be in their mid to late 60s. Currently, the proportion is 1 in 10. So you can see how the demand for healthcare is going to expand exponentially. The other problem is that 50% of us are either obese or overweight. Coupled with poor lifestyle choices like smoking and excess alcohol consumption, we are set to develop chronic and complex illnesses, diabetes, heart disease, and cancer at a much younger age and to a much greater extent. The other thing that has happened to us over the last few years is that we are sick of queuing. We will not queue even for a diagnosis or treatment. Even today, you can hop online and you can book a flight to Melbourne, order a book from Chicago, and make an appointment with your dentist with a few keystrokes on a computer. So genomics, robotics, electronics, nanotechnology seem to be set to change the way we experience healthcare into the future. But what I'm going to argue is that there is something fundamental that should not change in our experience of healthcare, as long as the patient is a human being. This is the device, the want of which kills 1 child every 15 seconds. 2.6 billion people have no access to sanitation. And it is this that kills more people than any infectious disease. So before we go getting ahead of ourselves in terms of what technology has to offer, this is the technology that has made the most difference to the health of mankind. So let us go back to the doctor. We are likely in the foreseeable future to be going to see the doctor when we develop symptoms. What is that experience like right now? Because this is what's going to tell us what the future holds in 30 years' time. Come with me through the keyhole as we peek into your consultation over the last few weeks. Let's start with this guy. Here is a man sitting at a desk. Armed only with the information I'm providing you in this photograph, can you tell me whether you think this man is honest, trustworthy, moral, ethical, or genuine? How do you feel about him now? In research that we're about to publish, you were 2 or 3 times more likely to say that this man was honest, trustworthy, moral, ethical, or genuine now that he's wearing a stethoscope. What do you think about him now? Well, again, in the research that we've done, you are 5 times more likely to think that he was honest, blah, blah, blah. This medical paraphernalia has an enormous impact on our response to our healers. Now, I want you to think about the last time you went to see the doctor. And it is likely to be for some minor self-limiting illness. I'm a GP, I would know. So you've gone and you've decided that you're going to see him about a sore throat. You take a shower in the morning and you change your clothes, because you do before you go to see the doctor. You then turn up at the waiting room and he calls you through. And you explain to him you have the worst sore throat you have ever had in your life. It's never been as bad as this. And he sits back and he eyes you in a fatherly or motherly way. And he says, tell me about yourself. And you say, well, I work at a call center. My boss is a bit of a bully. I'm making ends meet. It's a dead-end job. You're already feeling better because someone has taken an interest in you. Then he produces one of these. You recognize it. It's a lollipop stick. And in time-honored fashion, he says to you, open wide and say, ah. And that's what he can see. Now it can end in 2 ways. Whichever way, the outcome's going to be the same. He could say to you, well, most of these things are caused by a virus. This is a viral tonsillitis. I suggest you take a couple of paracetamol every 4 hours, take plenty of rest, and you'll feel a lot better in a couple of days. If not, come back and see me. Or alternatively, he'll say, I can see some white spots on your tonsils. You could have a bacterial infection. I'm going to prescribe 1 penicillin tablet 4 times a day for 10 days. If you're not feeling any better in a couple of days, come back and see me. Friends, when you go home tonight, have a look in the bathroom cabinet. Lurking at the back of the cabinet will be half a bottle of antibiotics that you faithfully said you would take for 10 days. Because when you left that consulting room, you felt so much better. You've been given a diagnosis of an itis. You've been told what was wrong with you. Someone had taken an interest in you, and you've been intimately examined, and you bet you got better. Okay. So the next time you go to see the doctor, you'll go with a tickly cough. It's never been worse, by the way. This is the worst tickly cough ever. And the doctor will examine you with a stethoscope. Magic. And when he's examining you with a stethoscope, you'll be thinking, my word, he must be hearing some amazing things. He's listening to my soul. Now, you see where the stethoscope is placed on this person's chest? I'll tell you what he can hear. I know I'm a doctor. Lub-dub. 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 That's your heart beating. Hopefully. And he'll say to you at the end of this consult, you've got a tracheitis. And the treatment for that is, most of these are caused by viral illness. And the treatment is a couple of paracetamols every 4 hours. And if you're not feeling better in a couple of days, come and see me. Oh, and try some lemon and honey tonight. Or alternatively, he'll say to you, you've got a bronchitis. Here's some antibiotics 1-3 times a day. By the way, have a look again in the cabinet. They'll be there as well. Now, we've talked about medical diagnosis, so I feel obliged to present you with a bit of science. This is it. It's called Bayes' theorem. And I ram it down my kids' throats all the time. Bayes' theorem says that when you look out the window from an Australian house, you're going to see a magpie and not a penguin. Common things are common. When you present common symptoms, the doctor is likely to diagnose a common illness, and it's not going to kill you. These are the various causes of abdominal pain. My favorite one is wandering spleen syndrome and Fitzhugh-Curtis syndrome. I had to look them up today, by the way, because in 20 years of medicine, I have never diagnosed wandering spleen syndrome. However, if I were to say to my patients who come to see me with abdominal pain, your tummy ache is caused by those dodgy kebabs you had at the weekend, they're not going to be awfully happy unless I've put them on the couch and examined them. It is that human touch that makes an enormous difference. It makes us feel so much better. Now, if any proof were required for the veracity of what I'm saying to you, this is it. Let me introduce you to your coccyx. This is the little bone at the bottom of your spine. You can upset this bone very easily by getting up out of your seat and launching yourself back down hard. Within a few minutes, you will get an excruciating pain. It will send you running to Google very, very quickly, and you will type in there, coccyx injuries off. And the unhappy news, my friends, is that it will say to you the treatment for this is a couple of paracetamols every 4 hours and plenty of rest. But I can guarantee you, within a day of having a sore coccyx, you will be making an appointment with your GP to perform some of that magic that helps you to feel so much better. This is this weekend's Weekend Australian magazine. And what it suggests is that we doctors are failing our patients by being so obsessed with technology. Because it says chiropractors are moving in on the family GP. Should they be allowed to treat sick kids? Wrong question. The question is, why are we taking our kids to see chiropractors in these circumstances? I want to end with a couple of slides, and this is one of them. This is one of my patients. Her name is Jenny Ryan. That, of course, is not her name, and this, of course, is not a photo, but it serves the purpose. Jenny Ryan developed breast cancer 8 months after she delivered her last baby. She has 3 children, aged 6, 3, and now less than 1 year old. Seen in the photograph with her is her mum, pretending to give her chemotherapy. Mum's not a nurse. Mum is living with diabetes, now supporting Jenny and her 3 little kids through an awful time. Chemotherapy, radiotherapy, mastectomy, aromatherapy, acupuncture, physiotherapy. This picture here poses the challenge for us as medical practitioners. The challenge for us is to diagnose Jenny's breast cancer at a time when it can be treated effectively, and to support her and her mum to get through the next few years. And I put it to you, my friends, that the best way for us to do that is by being the sort of doctor that you have been experiencing over the last few years. The doctor who lays on the hands and who takes an interest in you. Finally, this is Imhotep, the first ever doctor reputed to be the father of medicine. He was around about 3,000 years ago. Not bad for a 3,000-year-old guy. In his time, he received several accolades. He was the doctor to King Khosar. He was high priest of something or other. He was chief vase maker, which is my favorite title for him. But he was a doctor. And at the end of his life, he was deified by the Egyptians. And he achieved all this without a CT scanner, an MRI scanner, an ultrasound scanner, and even a stethoscope. And he did it by taking an interest in the people that he was serving. Thank you.